hormone, but that gets to the foundation of what we really do, Jay.
Right.
Bioidentical hormone replacement therapy.
Right.
And as we texted today, it came up today about people still, no matter how many times you tell them, do not understand what we really do. And it is very, very simple. It is understanding that each and every hormone, including growth hormone, the reason that we don't talk more about growth hormone is it's the only drug in the United States that you can't write off label. No other drug except growth hormone.
I wonder why.
So you can use it in patients off label, even though the literature shows the wonderful benefits it provide them, you can't use it off label. So they have to meet criteria for a growth hormone deficiency, which we discussed. But what is hormone optimization? What is it really? And people just cannot understand it. It is a very simple process. It's understanding as we age, our hormones decline. And with that decline, so goes our health. Hormones provide us with tremendous health benefits.
Right.
And each hormone provides us with beneficial effects. They all work synergistically, but they all provide us with beneficial effects. And the goals of what we do is to simply to maximize the beneficial effects by optimizing levels. The better the levels, the better the benefits we derive from those hormones.
That's right.
It's all about optimizing levels, maximizing benefits, and avoiding any unwanted side effects. It's just a balancing act there. And that's all that we do. So we're raising levels of the hormones that you naturally produce. You just don't produce as much of as you age. We're raising levels of the bioidentical equivalent so that you can maximize the benefits and receive all the health benefits they provide you. That's all that this is. And what really, nothing that kind of irritates me more than someone to say, well, you can take testosterone. If you feel better, you don't need anything else, especially if you have normal levels. Like if you have normal levels of DHEA, you don't need it. If you have normal levels of this, you don't need it. Well, if you had normal levels of testosterone, which most men do before they start testosterone because it's being used off label, then why would you not apply that same train of thought to every hormone?
Right.
It's like you do. If every man approached every hormone like they do testosterone, then they would have the battle won, because you want to raise levels of each hormone to obtain the benefits just like you do testosterone. That's all that this is. That's how it works. So we describe the benefits of each and every hormone to each patient, and better levels, better the benefits. Like Neil Rouzier always says, where do you want your levels to be? He wants that on his tombstone. Where do you want your levels to be?
Right.
What this is all about. So growth hormone the same way, the better the level. And we're not talking about bodybuilding levels. Just can't get out of their mind. I see people write about Rudy, what we talk about, and what Rob and I talk about, Jay and I, and they're like, oh, those guys, they're talking about these abusive levels. We're not. There's a bodybuilding world, and then there's our world, and then there's the actual traditional medicine world, which is let's raise testosterone levels a little bit.
Way behind.
Do that. Yeah. When you do that, you only get a little bit or no response. That's why in the Traverse trial that just came out in June, that over 60% of men dropped out of that trial that were on testosterone, which was the same number as the men dropped out that were on placebo, because men that get a little bit of testosterone don't feel any better. They're just going to stop treatment. And so the levels that we raise to, and I want to make sure this is real clear, it's an optimal level. Now, that's different for each and every man. But whenever we raise levels to an optimal level, which is typically going to be outside of the normal range, let's go ahead and say that.
Yep.
Every parameter of health that we measure improves. I don't know how many times I need to repeat that. Well, they say, well, I don't know the danger that they're causing, giving them these levels. Let me ask you this. If every parameter of health improves with those levels, what damage are you causing? We don't see it.